Go.
All right, class, this is your 2-minute warning, 2-minute warning till 8:30. Get your lecture preps out, put your phones away, do whatever you need to do. You have 2 minutes. All right, since you have your lecture preps out, can someone please tell me, in your own words, the definition of epilepsy? Nurse Justin. Please don't call me, please don't call me, please. I have, it's a person that has spontaneous seizures caused by chronic underlying condition. Right,
Yeah.
great answer. Now, can somebody tell me what the epidemiology of epilepsy is? So, what causes
Central
epilepsy?
nervous system disorder. So a disorder that happens in your brain. And this is when the nerve cell activity is disrupted or it's disturbed, and that's what causes the seizures to happen or the loss of consciousness, periods of sensations, unusual behaviors.
Yeah, there's also a genetic factor too that can be involved.
What is the geographical prevalence for this disease?
So over 3 million people have active epilepsy in the United States, and of each year about 200,000 new cases are diagnosed. It's becoming more common in more African American people and socially disadvantaged populations. And oh, you asked about age too. It's more common in older people if they're over 60, but it can happen at any age of life. And males are slightly more likely to get it than to develop it. Than females.
Describe to me how this is relevant to the HBU community.
So HBU has about 3,000 students on campus. I remember that from when I was like a tour guide here. But so with the statistic that there's 8.2 people with epilepsy for every 1,000 people, we should have approximately about 24 people on campus that have epilepsy or or at risk for epilepsy. Being an RA in the dorms, I've had 3 different accounts with students who have had seizures and due to their epilepsy.
Right, now can someone please tell me the different types of seizures?
Tonic-clonic. They lost consciousness for a little bit. They fell to the ground. This is where they might like drool a lot of excessive salivation. They might bite their cheek or bite their tongue, and they might have incontinence, so they'll wake up and there'll be urine on the floor. Their body gets real stiff, and then after they have the seizure, they don't remember, they're sore and they're tired. They sleep for several hours, and they just don't have no memory of what happened. The tonic phase is where the body stiffens for 10 to 20 seconds. The clonic phase is when the extremities are jerking for 30 to 40 seconds.
Good. That's what I was looking for. Did everybody hear that?
Now, can someone tell me the difference between the typical absence and atypical?
Okay, so there is a slight difference between typical and atypical. With typical, it's normally only in children, and by the time they get to adolescent age, it starts to cease. So they have like a daydreaming like spell, and in the spell they kind of just zone off. And if it's untreated, the seizures can occur up to 100 times a day, and sometimes people won't notice that it is an actual seizure happening, but it only lasts for a few seconds each time. So the difference between typical and atypical is that atypical, they have similar side effects. They'll have like a daydreaming spell followed by some peculiar behavior, like some confusion. But the main difference is that atypical lasts longer than a typical seizure, the typical absence seizure. So hyperventilation and flashing lights are 2 big things that can precipitate an absence
For
seizure.
focal seizures, can you tell me the clinical manifestations for that? Sarah, there you are, and you don't usually sit there. Come on, guys. You know you're not supposed to change seats. It's like church.
Seizures, also known as partial or partial social seizures, they start at one hemisphere of the brain, so it affects a specific area or a specific region of the cortex. And so because of that, signs and symptoms are related to the function of that particular area of the brain that is being affected.
What diagnostic test would we expect?
Well, they do CT scans, MRI scans, PET scans, and EEGs.
So some diagnostic tests that would be done for a patient with epilepsy would be like CBC A1C, urinalysis, creatinine, fasting blood glucose, electrolytes, and also a lumbar puncture test for cerebral spinal fluid analysis.
What are the risk factors for epilepsy?
Major risk factors that I have is babies who are born small for their age, babies who have seizures in the first month of life, babies who are born with abnormal areas in the brain, and bleeding into the brain.
If they have seizures within days after head injury, they're at risk. Also, if they have a family history of epilepsy, somebody in their family has it. If they have Alzheimer's disease. Also, if they use any drugs, like cocaine and stuff. And if they've ever had any mild head injuries, they're really at risk.
If it happens to the brain, like infections of the brain, a stroke of the brain, or brain tumor, serious brain injury. Now let's discuss the complications of epilepsy.
So they won't do well with school or at home. They just overall just won't be doing well.
They might have cognitive learning problems.
Also, they might have symptoms of depression, anxiety, or other changes in mood or behavior.
Problem sleeping.
Unexplained injuries, falls, or other illnesses.
Thinning of the bones.
Reproductive problems.
Risk of death. Is this contagious, and how can we prevent that?
No, it's not communicable or contagious.
So some preventions are medicine compliance. You have to take your medicine every day.
Also, they need to know their triggers. They need to know certain things that will cause the seizures, such as flashing lights or hyperactivity.
And wasn't there something about water?
Oh yeah, they have to avoid water sports too, or being in the water for a prolonged time.
And they need to make sure they keep up with their doctor appointments and talk with the doctors, because sometimes their medicines might need changing. What is the treatment, and what is the treatment goal? First, I'm going to say the treatment goal. And the goal is it cannot be cured, but we can treat the patient so that they don't have seizures or limit the amount of seizures they have and the effects of the seizures.
Also, if the drug therapy doesn't work, they can have surgery, but they have to be a specific candidate for the surgery. They have to have a confirmed diagnosis of epilepsy. They have to use drugs for a certain amount of time, use the drugs that are prescribed without any satisfactory results. And the last one is they have to have a defined electroclinical syndrome, which is a type of seizure disorder. Those are the three requirements for them to be able to have surgery. And the goal with that surgery is for them to remove the epileptic focus and stop the spread of epileptic activity in the brain.
And one drug that is probably important for us to know is Dilantin. It's also known as phenytoin. Is that how you say it?
Mm-hmm. Yeah.
And then it is an anti-seizure drug.
Let's talk about the financial burden. What would it look like on the side of the patient, the family, and the society financially? What would that look like?
So according to the CDC, the cost of medications alone every month is between $1,000 and $3,000. Also, $1,800 is the average cost per day for a hospital admission in the U.S. of a person with epilepsy.
And for the family, the average income for men who have seizures that he pays over a lifetime is $317,000 over a lifetime that he spends on epilepsy. And then the woman, out of her income, it would be $140,000. That's a lot.
For society overall, the total indirect and direct cost of epilepsy is estimated to be $15.5 billion yearly. This is according to the Bureau of Labor Statistics data. So with that, it's also a big burden on the family because a lot of epileptic patients, when we did our research, we found that a lot of epileptic patients actually lose their jobs too. So that has a big impact on the financial
What about the emotional and spiritual effect?
For someone with a seizure, seizure disorder may be adjusting to the personal and societal limitations that is imposed by the illness. So discrimination in employment is one of the more serious problems that a patient with a seizure disorder may face, and epilepsy may cause a person to have declining feelings about themselves and about life in general, while others may have found comfort in seeking out a god
If
or a
any,
higher.
are there any rehab services that you should provide for your patient? And two, what kind of supports resources would you provide for your patient and
There
family?
are actually a lot of support resources and services and long-term care services that are provided for the patients. So, for example, as well, or the people that have epilepsy as well as their families. So, some examples would be like the State Department of Vocational Rehab or the U.S. Equal Employment Opportunities Commissions. These two are great sources for people who have issues related to job discrimination. The local chapter of the Epilepsy Foundation is a volunteer agency that offers a variety of services to patients with epilepsy. Department of Veterans Affairs Medical Center, which provides comprehensive care to eligible veterans. Community mental health services like West Oaks, Harris County Psychiatric Center. These are for those who need intensive psychiatric counseling. Social workers and welfare agencies can also help with financial problems and living arrangements. Like state agencies specializing in vocational rehab services can provide vocational assessment, counseling, funding for training, and assistance with job placement for those whose seizures aren't really well controlled. And they can also offer financial assistance for transportation and medical costs related to vocational rehab or for job maintenance. So, other governmental health resources would be like the Department of Health and Human Services, Health Resources and Services Administration, the National Institutes of Health, National Institute of Neurological Disorders and Strokes, mental health resources that are by state, disability resources like CDC's Disability and Health Information for people with disabilities, communicating with and about people with disabilities, that one is actually a PDF handout that you can download off of the CDC's Disability Resources website, or U.S. Equal Opportunity Employment Commission, which I stated before. So local rehab services for long-term care would be, the major one would be the Epilepsy Foundation. They could be located on 2401 Fountain View Drive, Houston, Texas 77057. National associations of epilepsy centers includes Memorial Hermann Hospital, the Level 4 Center, the Adult Epilepsy Center, as well as Houston Methodist Hospital, Level 4 Center, Adult Epilepsy Center, Texas Children's Hospital Level 4 Center, the Pediatric Epilepsy Center. So as self-limiting as epilepsy may be or seem to a person, there are a variety and a lot of services and resources that they can have at hand.